You spend roughly a third of your entire life completely unconscious. That means if you live to 80, you will have clocked somewhere around 26 years just lying there. And yet almost nobody thinks about how they're lying there. Because it turns out the position your body defaults to every single night is quietly shaping your health in ways most people never connect. Your back pain, your foggy mornings, your acid reflux, your wrinkles, yes, your wrinkles. All of it has a direct link to how you sleep. So today, we are breaking down every major sleeping position, what each one is actually doing to your body, and which one science says is genuinely the best. Stick around, because the last position on this list has a benefit so surprising that most doctors don't even bring it up. Let's start with the most common one: back sleeping. About 8% of people sleep this way, which is surprisingly low, given how often it gets recommended. When you sleep flat on your back, your spine gets to rest in its most neutral position. Your weight distributes evenly, your joints aren't being compressed at weird angles, and your head, neck, and spine can actually line up the way they're supposed to. For people dealing with chronic back pain or neck pain, this position is often the first thing a physical therapist will suggest. There's also a cosmetic benefit nobody talks about. Because your face isn't pressed against a pillow, you get significantly less sleep creasing. And over years and decades, that actually reduces wrinkle formation. Sounds minor until you think about 26 years of face compression. But back sleeping is not perfect. If you snore, this position makes it dramatically worse. When you lie flat, gravity pulls your tongue and soft tissues toward the back of your throat, narrowing the airway. For people with sleep apnea, back sleeping can be actively dangerous because it increases the number of times breathing is interrupted throughout the night. Pregnant women are also advised to avoid this position, especially in the third trimester, because lying flat on your back puts pressure on a major vein called the inferior vena cava, which can reduce blood flow back to the heart. Now let's talk about stomach sleeping. Around 7% of people prefer this, and unfortunately, it is almost universally the worst option across every health metric. To breathe while lying face down, you have to rotate your head completely to one side. Hold that position for 8 hours, and you can imagine what happens to your neck. The sustained rotation puts enormous strain on the cervical spine, and stomach sleepers are disproportionately represented in chronic neck pain statistics. Your lower back also suffers because with nothing supporting the arch of your spine, it tends to hyperextend throughout the night. Over time, this contributes to lumbar problems that are very hard to reverse. The one group that might actually benefit from stomach sleeping is people with certain digestive issues, since the position can sometimes ease discomfort after eating, but even that benefit is outweighed by the structural damage being done elsewhere. If you're a stomach sleeper, the single best thing you can do for your body is start training yourself out of it. Side sleeping is where the majority of the population lives. Roughly 69% of adults default to some version of sleeping on their side, and the research suggests this is actually one of the better choices available. Here's where it gets interesting though, because not all side sleeping is equal. The side you choose matters enormously. Let's start with right side sleeping. When you sleep on your right side, your stomach sits above your esophagus, which sounds fine until you realize that means stomach acid can travel upward more easily. Right side sleeping is directly associated with increased acid reflux and heartburn symptoms. For people who already struggle with GERD, sleeping on the right side can turn a manageable condition into a miserable night. Your heart also works slightly harder in this position because of how the internal organ weight distributes across your chest. Left side sleeping flips all of that. When your left side is down, your stomach is positioned below the esophagus, which means gravity is working with your digestive system instead of against it. This is why doctors consistently recommend left side sleeping for people with acid reflux, GERD, and even general digestive discomfort. Your heart also benefits because the orientation reduces compression and allows better circulation. Pregnant women are specifically advised to sleep on their left side because it optimizes blood flow to the fetus and reduces pressure on the liver. There is also compelling neurological research suggesting that side sleeping in general, and left side sleeping in particular, may enhance the brain's ability to clear waste products through what's called the glymphatic system. This is a drainage network in your brain that activates during sleep and flushes out toxins, including proteins associated with Alzheimer's disease. The research is still developing, but the implications are genuinely exciting. The downside of side sleeping is shoulder and hip compression. Whichever side you're lying on is bearing significant sustained pressure, which can cause soreness, numbness, and over time may contribute to shoulder joint issues. Placing a pillow between your knees and using a supportive mattress dramatically reduces this problem. Now, the fetal position. This is a specific variation of side sleeping where you curl your knees toward your chest and hunch your shoulders forward. It's the most popular sleep position on the planet, and it has a complicated relationship with your body. On one hand, you get the benefits of side sleeping. On the other hand, curling tightly restricts your diaphragm, meaning your breathing is shallower throughout the night. It also puts your spine into a sustained curve that can worsen back and neck pain over time. The fix is simple. If you're a fetal sleeper, try to keep the curl loose. Same position, less compression, dramatically better outcomes. Elevated back sleeping deserves its own mention. This is where you sleep on your back with your upper body slightly inclined, usually using an adjustable bed or a wedge pillow. This position combines the spinal benefits of flat back sleeping with gravity assistance that reduces snoring, acid reflux, and even swelling in the legs. For older adults, people recovering from surgery, and anyone with respiratory issues, this is often the optimal configuration. It is the position most frequently recommended in hospital settings for a reason. So what should you actually take away from all of this? If you sleep on your back without snoring or sleep apnea issues, you are likely in the best position for spinal health and skin longevity. If you are a side sleeper, prioritize your left side where possible. Use a supportive pillow that keeps your neck aligned with your spine. And consider placing a pillow between your knees to reduce hip and lower back strain. If you snore or suspect sleep apnea, side sleeping is almost certainly better than back sleeping, and you should talk to a doctor. If you stomach sleep, the single best thing you can do for your body is to start training yourself out of it, even if it takes weeks. Here is the deeper point that ties all of this together. Sleep is not passive recovery. It is one of the most active biological processes your body runs, clearing toxins from your brain, consolidating memories, repairing tissues, and regulating every major hormone system. The position you sleep in either supports or interferes with all of that. You are going to spend decades asleep. The way you do it actually matters. So tonight, before you close your eyes, think about where your body is going to be for the next 8 hours, because it is more important than most people ever realize.